Hi everybody, it's Chloe here from House of Chloe. I hope you're all well. I'm here to just talk a bit about Maskne and what's happening underneath the mask. So, as I look forward to opening up House of Chloe, the treatment room, I know that I'll be wearing my mask for long periods of time. And if you have to wear your mask for work for long periods of time, then this video is for you. You might have noticed some changes in your skin, some of them not so good, and some of them can be attributed to the term maskne. So maskne is acne or facial rashes that occur due to wearing a face mask and the sweat and humid environment underneath the mask. It's a moisture-rich environment, and in that way it's quite bacteria-rich because you're breathing and the breath creates a lot of an imbalance of your bacteria and an imbalance of your pH levels, increased dehydration, and a lot of other things going on. So in addition to an increase in bacteria, there's also friction happening at the site of where the mask sort of hits the skin. So yeah, there's certain areas of rubbing that's happening. So yeah, we'll go straight into it. So the contributing factors of maskne are definitely an ill-fitting mask. So if you've got a mask that is rubbing or moving around too much, that's going to cause friction. Materials of the mask that irritate, so any material that is synthetic or that doesn't allow sort of breath to pass through. Unfortunately, in the way of just the disposable masks, the medical grade disposable masks are, I found, to be the most beneficial in preventing irritation because they are permeable with breath, but also they are safe and, you know, in protecting you from airborne diseases, which is why we're wearing the mask, of course. So yeah, the material of the mask really matters. If you're using a reusable mask, which I love the reusable masks, then being careful of what sort of you're washing them in. So soap or detergent with fragrances can cause a bit more of an increase of irritation, and making sure that your mask is fully dry as well. So yeah, just making sure that your mask is fully dry and fresh and clean. If you're wearing a mask for over 20 minutes, then at a time, so 20 minutes to 3 hours, at the 3 hour mark or less, then having a break of about 15 minutes is really good. If you're then going to put on that same mask, sometimes that's not very good, so you can change your mask at that point. So yeah, over about the course of a day, if you're starting at about 7 o'clock or whatever and going till about 5 or 6 or 7 at night, you'd probably be using about 3 masks on average during that time, just to keep a fresh mask with you at all times. Yeah, and then also wearing makeup underneath the mask, particularly foundation, concealer, lipstick, and blush is not really a great idea, especially along the areas that sort of sit on the skin that are going to rub when you're talking and breathing and moving. So even just, yeah, everywhere there, it's just really not a great environment for, you're pretty much deeply infusing your makeup. Even if it's mineral makeup, it's really not good to be wearing underneath your mask. So limit any makeup that you're wearing under the mask would be good. Something like a pillowcase change every night so that you're sleeping on a beautiful fresh pillowcase every night is a great tip. Then if you're using sort of the wrong sort of skincare. So if you're using skincare that irritates you, something that stings or that dries you out too much or anything like that, getting on the right sort of skincare route is really important. And yeah, the skincare that you use should really be nourishing and beautiful and comfortable. Yeah, making sure that any skincare that you do use is of course in date, and a lot of skincare have like a little open bottle or a bottle with like a lid open, so that's when upon opening or using the product for the first time, it's got usually a 12 on the inside of that bottle, and that means you must use that product within 12 months of opening. Otherwise the product oxidizes, and that can also cause either it's less effective, and also it might cause bacteria, or it might cause irritation to the skin after that, because there's certain there are certain additives in a product to help it to stay fresh. So additives in a product do go off, and yeah, you don't want to be applying any product that is off onto your skin. So an increase in stress will definitely contribute to your maskne, sort of what's going on under the mask. Hormonal imbalances and fluctuations are going to also definitely impact breakouts, especially in the way of cystic breakouts. So if you want to go and get a blood test at your GP to test your hormone levels and just check that everything's okay, then that would be good. Something like that you can get easily that is a non-prescription option is a zinc supplement. So usually in an acne sort of condition, what is presented is a zinc deficiency in that person. So yeah, you can always just try a low dose of zinc and add that to your diet. Of course, you can get zinc naturally in a lot of different food, but I find that sometimes just adding a little supplement is really helpful, and zinc is a beautiful, it doesn't have any side effects, but definitely check with your GP if you're concerned about it. And obviously take it within the dose prescribed on the bottle or by your GP. Same with essential fatty acids. So the OCosmedic range has an EFA Max complex, and I love taking mine at nighttime with dinner, of course. It's good to have it with a substantial meal, or even with essential fatty acids in a meal. So like eggs or avocado, you can have your essential fatty acid supplement with that, and that's going to enhance your uptake of your EFA Max complex. So this is a powerful antioxidant that you can be taking. It increases hydration and helps fight inflammation. It helps regulate your sebum production, which is your natural oil production in your skin. So if you aren't producing enough sebum, if you're dry skin, then it will help to boost that, but it will also help to level out an overproduction of sebum. So if you've got an oily skin type, it's great as well. And then it also helps to fight acne as well. So in that, because it actually helps to hydrate the skin. Dehydration is a really intense, well, it is a contributing factor of acne, of any type of acne as well. So definitely essential fatty acids for the internal hydration factor and keeping everything beautiful on the inside and outside. Yeah, so then of course diet is very important, and sleep is very important, or lack of sleep will have an impact. Increasing your water intake will help to increase your blood circulation. I noticed that if I go for a blood test and I'm dehydrated, my blood does not flow, and it's horrible. Whereas if I drink heaps of water before my blood that I'm giving, it just flows really well. So that's just a really easy way to see that, that water is life-giving for your blood, oxygen. It helps everything, obviously. So lots of water, or herbal teas with non-caffeinated herbal teas, or whatever you like to drink. And then also something that you might not have thought of is mouth health. So your oral hygiene is really important underneath the mask, of course. So keeping up with your teeth brushing, and if you want to use a mouthwash, sometimes maybe you could take a mouthwash with you to work if you want. So after you eat, you could use a bit of a mouthwash and then put your face mask back on, or a fresh face mask back on, of course. And then something easy like, something that I might have mentioned before already is, of course, using an unclean mask. If you're going to put an unclean mask back on, that's going to reintroduce bacteria and nasty stuff. And then hydration, of course. So topical hydration is really important, having a really good moisturiser to fall back on morning and night, and even applying a really light, beautiful moisturiser in the middle of the day if you want to, or a hydrosol, sort of a spray, a mist or something. There's a really great mist that I'll introduce you to called the Clini Prep from DP Dermaceuticals, which is a dermatologically tested little Clini Prep spray that you can use. And then gentle and regular exfoliation. So definitely exfoliating with like an enzyme. You can be doing maybe 3 times a week if you've got really cystic acne or really angry acne. Definitely keeping up with your cleansing, of course. Something like the gentle antioxidant cleanser morning and night, and then using an enzyme exfoliant like the 3-in-1 fruit peel mask, maybe 2 to 3 times a week, or every 3rd night, or every 2nd to 3rd night you can be using that. If you've got active breakouts, I always fall back on, when was the last time that I exfoliated, and usually that will help to clear my breakout quicker, of course, because it's helping to decongest the area. It's helping to draw out the infection, and it helps to, because really acne and breakouts is an infected ingrown hair inside a hair follicle. You have beautiful, soft, vellus hair all over your skin, and a breakout is happening within a hair follicle. So if you think about a closed over hair follicle, which is an ingrown hair that cannot escape, and it's blocked, and then inside that hair follicle you will have an infection happening, and it varies in degree of infection. So the bacteria within that hair follicle needs to escape, so helping to slough off the dry dead skin cells and helping to draw out that breakout is really important, with beautiful constant exfoliation, but gentle exfoliation is the key. So yeah, I think that, of course, I'll finish this video with talking about, of course, there's in-house treatments that you can be doing, but these are all things that you can be doing at home. And I will introduce you next time in the next video to a Maskne battle kit that I've developed for you, and I'll go through a little tutorial then. So I'm very excited to introduce an LED system into House of Chloe, and you can find out more information about that on my brand new website that I've built myself. I know I've harped on about the website, but I've taught myself how to build a website, and I'm so proud of it, and I can't wait to show it to you. So you'll be able to explore that soon. Okay, so thanks for watching, and I hope you've found a lot of helpful little tips and about our little discussion about what Maskne is and the contributing factors. Okay. Leave me any questions below and we'll talk soon. Okay, bye.